Welcome to Everyday Nursing Knowledge Lectures, and today we will learn how to place electrode to get a 12-lead ECG. So 12-lead ECG gives more information or accurate information for the diagnosis of cardiac arrhythmia or coronary artery disease in case of STEMI. What is the difference between electrodes and lead? Electrodes are pads connected to the skin to get an ECG tracing, whereas lead is the electrical activity obtained by placing these electrodes. And in 12-lead ECG, you are viewing the electrical activity of the heart from 12 different viewpoints. Before placing electrodes, what are the key points you have to remember? You should always dry the skin. You can use a dry gauze or alcohol swab if the skin is greasy. If you are using alcohol swab, let the skin dry before placing the electrodes. If there is excessive hair may be clipped using a surgical clipper. Electrodes must be in full contact with the skin to get a good ECG tracing. Avoid placing electrodes over bony prominence, over clavicle, over pacemaker. If pacemaker is present, keep electrodes 3 to 5 inches away from the pacemaker. If the patient has implanted device, example implanted port, do not place electrodes on top of it. Now to get a 12-lead ECG, you have to place 10 electrodes, 4 electrodes on the extremities and 6 goes to the chest. The 4 electrodes on the extremities gives limb leads, whereas 6 electrodes to the chest gives chest leads. Now let's see the placement of these electrodes. There are 4 electrodes that goes to the extremities, which is right A is right arm, LA is left arm, RL is right leg, and LL is left leg. RA goes anywhere between right shoulder and above right wrist. LA goes anywhere between left shoulder and left wrist. RL goes anywhere below right torso. Torso is the trunk of the human body, so below right torso and above right ankle. LL goes anywhere below left torso and above left ankle. When you are placing limb leads, you should always make sure there should be uniformity in placement. Example, if you are placing RA above right wrist, make sure you are placing LA also above left wrist. If you are placing RA on the upper arm, LA should be also on the upper arm. Now let's see the electrodes that goes to the chest. There are 6 electrodes that goes to the chest, starts from V1 to V6. V1 you place right side to the sternum, 4th intercostal space. V2 is left side of the sternum, 4th intercostal space. V3 goes between V2 and V4. V4, V5, V6 is at the same level, that is 5th intercostal space. V4 goes mid-clavicular line, this is clavicle, mid-clavicular line, 5th intercostal space just below V3. V5 is anterior axillary line at the same level of V4, and V6 is at the mid-axillary line at the same level of V4 and V5. So today we saw placement of electrodes in 12-lead ECG, and thanks for watching my video.